Hello everyone, how are you all doing? Today I'm going to show you a hysteroscopy video. Our case is a 31-year-old woman who has frequently visited the emergency room since her teenage years due to painful periods. She managed with painkillers all this time, eventually got married, and during a checkup for pregnancy planning, an ultrasound suggested a possible uterine septum and she was referred to us. Later we ordered an MRI which showed a 1.5 centimeter septum. Now as we enter part of the uterus, we can see where the tube opens on one side. Now we're trying to get to reach the fundal part of the uterus. So looking on the left side, we see the tube opens here, you see it, as we aim to identify two separate compartments in the uterus. You can see the septum between the two compartments. And now we are starting to cut the uterine septum. It's crucial to be careful here during cutting it, as there's a risk of cutting the uterus itself. The procedure is going on, still going on, and I'm cutting the fundal part of the septum. Careful cut, and we see and notice the small bubbles you see inside. These are from the saline solution we are using to inflate the uterus. We need the pressure in the uterus. I'm still cutting the septum. You can see where the sperm would enter on the left side as the tube opens. There are just a few more areas to cut, and while I'm monitoring with the ultrasound, a friend of mine is helping me during the procedure. We are checking also the ultrasound. So we are making here very small incisions. In literature, there is no exact guideline on how much should be cut, so this remains a subject of debate, and it requires experience and pre-surgery discussions between the patient and the surgeon. In my view, here the procedure is complete, and this uterus should now be suitable for a healthy pregnancy and a healthy baby. And this patient has no previous pregnancies. I'm just taking a final look to ensure everything is in place, and also checking the ultrasound, but you can't see the ultrasound procedure now. And if the septum left untreated, a uterine septum can unfortunately lead to miscarriages, preterm births, or the baby adopting an abnormal position in the womb. That's why it's essential to evaluate for this condition during examinations. The entire surgery technique and process should be discussed in detail with your specialist. Thank you for watching.